Welcome to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and the latest in medical insights. I'm your host, Rhonda Alfred. Joining us today is Dr. Christopher Cenac, an orthopedic surgeon at Gulf Coast Orthopedics and Terrebonne General Health System. We're going to be talking about spinal cord stimulator procedures. Welcome to the show, Dr. Cenac.
Thank you very much for having me.
Well, tell us a little bit about yourself. I'm so glad you're here today.
My name is Christopher Cenac Jr. I'm an orthopedic spine surgeon. I've been at Terrebonne General and in Houma, Louisiana for 20 years now. And I've seen some things now that I've been here a while come and go. And one of the things that I didn't have a whole lot of experience when I started 20 years ago has really come to the forefront. It's called a spinal cord stimulator. Mm-hmm. A spinal cord stimulator is a small, like electrical generator. Think of like a battery pack that has a wire, and that wire goes to a small lead or tip, and that would go onto someone's spinal cord, usually put in the middle of the back, and the little battery is placed in their side of their buttock, and it can relieve pain that's in their back or their legs. So it's a pretty amazing device.
Yeah, pretty high tech it sounds like.
It's very high tech. It has a lot of technology in it. It's usually $30,000 to $40,000 for the implant.
Is it? How does it work exactly?
Well, it sends this generated pulse up these leads, and when your, let's just say, left leg feels pain, it goes up your left leg, up your spinal cord. This thing is laying on the spinal cord, and somehow electrically it changes that signal where your brain doesn't get the final signal. So it kind of diverts the pain and messes it up to your brain, so you don't feel it.
So you don't feel like you're in pain. So that's how it works. So is this procedure a surgery?
So basically, we use this device. Kind of is not our first line of treatment. It's kind of our last line. We have several kind of last lines of defense, and this is one of our last ones. So this is a device for people with what we call chronic pain, someone who's had maybe some surgeries that are helpful but not enough. Mm-hmm. Maybe they have some issue where they can't really have a large surgery because of age. We have that, or complicating factors, pulmonary issues, etc. Or it's something where someone has peripheral diabetic neuropathy of their feet, chronic numbness, chronic leg pain from an amputation or near amputation, or a variety of other issues. But this is a device that we use on people to hopefully get them some relief when basically the normal measures could not. And to, quote, get it or try it, you have to do a trial procedure. You have to do a trial for several reasons. A, as the doctor, I want to make sure something works for the patient, the therapy works. And B, you want it to be successful in the patient, so you want to make sure it's compatible with them and addresses their needs. And the insurance company wants to dang sure make it right because they don't want to pay for it if it doesn't relieve your pain. So we do a trial, which is a small wire, and the wire sticks out your skin in a sterile package. We take you to surgery, put this little wire in your back, and put this little package on your back for 4 or 5 days. It's sterile, and a girl or a guy who's with the company will follow you kind of around wireless now, and they will call you and check with you a couple times a day, and they'll adjust the program on this device, which has like 3,000 programs, to tailor your needs. Mm-hmm. So over 4 or 5 days, we trial it, and if it works, we then submit to the insurance company, hey, for instance, Ms. Alfred had great success with this device, and we would like to put it in. We'll submit it and then hopefully get approved.
So you can try it before you buy it.
You try it before you buy it.
That's pretty amazing. I know we're going to talk with your patient, Kevin Ordoyne, a little bit later.
Certainly.
But did this is what procedure you used with him, and he said
Kevin's a patient who I'm very familiar with because he's had very catastrophic type orthopedic injury. He was hit in a head-on collision by a drunk driver, I think when he was 18 years old. And he's had something like 60-something surgeries, maybe 66, but 60-something surgeries, not, of course, by me, but by a team of doctors over time trying to save his leg. He's had a massive pelvic surgeries, back surgeries, etc. So when I inherited him, he had lots of issues, chronic pain, and we were able to use this device to help him get out of pain, which, again, if it can help a person who's had 60-something surgeries, I think it can help anybody.
That's right. So it has a lot of benefits for the patients. What are some of the benefits for patients?
Some of the benefits is it's non-narcotic or non-drug, meaning you can have this device and any amount of medicines, narcotics or not, the person's taking, they can be decreased because this is it's an electrical device. It's safe to have an MRI with it, so it's compatible with that. It's safe, just like a pacemaker is safe to put in someone. The batteries last upwards of 10 years. There's kind of two versions. There's a rechargeable and a non-rechargeable, but they can last anywhere between 5 to 10 years, depending on how much power you need to put to calm the patient's pain.
So it lasts for quite some time.
It
So what
lasts a
would you
while.
tell to a patient who's a little bit hesitant about doing something like this?
Well, I would say, number one, in life, you got to keep your options open. I have people who come to me before I say something. They say, well, I'm not here for surgery. And I said, well, I didn't offer you surgery. My point is, don't close the door to something that you don't know about. If you think you're possibly a candidate, if you have chronic numbness in your legs, you've had a failed surgery, you've had chronic issues that are just nobody can fix, it's worth talking about it, having an open mind. You may not be a candidate, but at the end of the day, keep your options open. It's a very simple and safe procedure that, again, if my mother had this, I have no problems doing it to her. I always tell someone, I'm treating you just like my family, and it has some comfort to them that I would do this for them.
Well, thank you so much for sharing all this helpful information, for
You're
all
welcome.
the things that you're bringing to the table for patients who are in pain.
Well, thank you. We as surgeons are always trying to fix someone, and we do our best to make sure no stone's unturned. But at times, we don't have all the answers. And this is our kind of last-ditch device that even if we don't know, and even if we are a little disappointed we didn't get what we wanted, the patient or the doctor, we have this device to get us out of some very tight situations.
Well, good to know we have options available.
Yes, and the one we use is from Abbott Spine, one of the largest companies in the world. You can read about it on their website, and this is one of the devices models that we use right here.
Well, thank you. Thanks for bringing that visual. It kind of makes it all real.
Thank you so much.
All right, thanks for being with us today.
Appreciate it.
We're now joined by Dr. Cenac's patient, Kevin Ordoyne. Kevin, thank you so much for coming to the show today.
Thank you for having me.
Well, can you tell us a little bit more about yourself?
My name is Kevin Ordoyne. I'm 54 years old. I'm a resident of Thibodeau, Louisiana. I'm a veteran of the United States Army.
Thank you for your
And
service.
I've been a patient with Dr. Cenac for roughly 10 years or so, 10, 12 years.
Okay. All right. Well, I know we're going to talk about your spinal cord stimulator placement. So tell me about your what type of pain and mobility issues were you having prior to your placement?
For roughly 33 years, I've dealt with a multitude of pain issues, such as nerve pain from nerve damage, muscular pain, joint pain, and pain also associated with osteoarthritis from injuries I sustained.
So how did it affect your day-to-day life?
Many ways. It stole my enthusiasm to perform normal daily duties, house chores. It took away the enjoyment of activities, prevented me from, standing or walking for a long period of time or longer distance, and just dealing with the pain on a daily basis was a hard issue also.
So how did you decide to have this procedure?
Dr. Cenac had suggested that I consider it, and I considered it. I did my own research, spoke to some friends that I know that had the procedure, and I put my full trust in Dr. Cenac. I knew, he did wonders for me, helped me out in many ways, and
Were you hesitant before having the procedure done?
I was hesitant. I didn't know what to expect of the procedure, how it would feel. But again, I put my full trust in Dr. Cenac. He spoke to me thoroughly about the procedure and the aftermath of it, you know,
And
and it all went well, you know.
so, how has your life changed now that you've had the spinal cord stimulator procedure?
I find I have more energy, more enthusiasm to do some chores, house chores, more enthusiasm to get out and do daily activities. I find I'm able to stand longer, walk longer distances
Mhm.
without experiencing so much pain.
Mhm.
You know,
Do you have any hobbies that you're pursuing now, or?
I used to love jogging, but I can no longer do that no more. My right ankle is fused from injuries and stuff like that.
Mhm.
But I still get out. I go to concerts whenever
Yeah.
available. I go to festivals.
Yeah, it's that time of the year right now as
Yes,
well.
yes.
So, what would you say to someone who is on the fence about possibly getting a procedure like this done?
Give it strong consideration. Give it a chance. You know, there's nothing you can lose. You know, it's to me, it's a win-win situation. You know,
Mhm. Mhm.
it's worked greatly for me. I enjoy life more because dealing with pain, it's a struggle. It wears you down mentally,
Mhm.
emotionally, physically. You know, a lot of people don't understand pain, and
Yeah, they
it
don't have it.
it takes its toll on a person's life.
Well, tell us a little bit about how the stimulator works. I mean, do you have to press something or is it just an automatic?
You basically have a control modem like a cell phone,
Hmm.
and they have different programs on the phone. One is a burst program where you don't feel it, but it's still working. It's still blocking the pain signals going to the brain. It also has a tingle program where you do feel it. And for anyone who has worn a TENS unit
Oh, yeah.
on the outside, it's like a TENS unit on the inside. It almost feels as though you're wearing a TENS unit pants. And
Oh,
it's
wow.
actually, it's comforting.
It's like,
It blocks the signals and
hmm
it's actually relaxing, you know. So it's not a bad experience. It's rather good. I don't deny doing it.
good. I'm so glad. It's so great to be able to be restored back to your daily life. And a lot of people do suffer with pain. So, was this a last resort for you, or how did you get to this point?
I got to this point because I tried everything else, from epidurals to spinal injections. I've had spinal fusions, other joint fusions, just about anything that can be done, I've done it. You know, I've had 66 surgeries, and as far as I know, this was my last option, and I'm glad I took the option
And it's
because it
working.
has worked well, you know.
Well, that's wonderful.
So great.
Well, thank you so much for sharing your story with us. We
Thank you for
appreciate
having
it.
me.
All right, best of luck. And, I'm glad you're getting out there and living life.
All right, thank you.
For more information about the spinal cord stimulator procedure and Dr. Cenac, please visit tghealthsystem.com. Don't forget to like, share, and subscribe to our podcast where you get your podcasts. Thanks for being with us.